Welcome to Class 3. Today we're going to talk about progesterone. Progesterone is a female hormone that we want to be in balance with the estrogens. As women age, especially after their 40s, progesterone levels start to drop little by little all the way through menopause. This lack of progesterone shows up as sleep disturbances and anxiety. There might be some association with increased blood pressure and weight gain, but that association is a little bit less clear. The main reason any type of progesterone is prescribed in menopausal women is to prevent estrogen from overstimulating the uterus. When estrogen is used by itself, there's an increased risk that the uterus can form cancer cells, leading to uterine cancer. The most commonly prescribed forms of progesterone for menopause are the bioidentical version and the synthetic, which is called Provera. The generic name for Provera is medroxyprogesterone acetate, and I bring this up because MPA is the way the initials are seen in all the graphs for the Women's Health Initiative study. So going back to that huge amount of data with the Women's Health Initiative, when that data was re-examined, they found that the increased risk of breast cancer was in the women who were on estrogen and Provera, not in the women who were on estrogen alone. So even though estrogen gets a bad rap for causing breast cancer, in that study it showed that the increased risk was to women who were on Provera plus estrogen. So because of studies like this, physicians who are studying functional medicine, we really don't prescribe Provera, this synthetic progesterone, to anybody. We prefer overwhelmingly using micronized progesterone, either orally, sometimes topically. Even if a woman has had a hysterectomy, so she doesn't have a uterus, functional medicine physicians will still prescribe a progesterone in order to help sleep, and there is some data to support that it is protective for breast tissue. For conventional physicians, there still seems to be a role for Provera in their treatment options. More and more physicians are finding that oral micronized progesterone is just a safer option overall. The disadvantage to it is that it is more expensive than Provera or medroxyprogesterone acetate. For menopause treatment, progesterone is not used by itself. Too much progesterone without the balance of estrogen can lead to weight gain, fatigue, moodiness, and bloating. You can get topical progesterone online. These are plant-based sources, and I urge you to use caution before doing this. I have recommended them in patients when we are trying to decide whether their tiredness or sleep disorder is due to hormone changes, and I'll do it for a trial, no more than 2 weeks. At that point, then we know if it's effective, we should go ahead and test for their hormones. If it's not effective, then we should look at other reasons for their insomnia. I do not recommend using topical progesterone without consulting your provider. So class number 4 is going to be discussing testosterone and DHEA.